Hello, this is Dr. Turkmani, and this is another interesting case of cataract surgery. That's a patient who had a contact lens related ulcer. You can see there the subsequent corneal scarring, cataract formation, and synechiae with cyclitic membrane. I've done the two paracenteses and the main incision. I've done vision blue, and now I'm doing I'm breaking the synechiae with the use of viscoelastics, but you can see how that cyclitic membrane or remnants of the cyclitic membrane is refusing to break just with viscodissection. I've managed to separate the attachments of the iris to the anterior lens capsule with the viscodissection. However, that cyclitic membrane, which is refusing to break, can compromise my capsulorhexis. So after a few attempts, you can see how I managed to get a larger and rounder pupil, but that cyclitic membrane is still there. So I switch now to a bimanual technique. I've switched off the main light and just kept the coaxial light to enhance visualization through the corneal scar, and with a bimanual technique I'm grabbing that membrane with micrograspers and cutting with micro scissors through the paracentesis. Now I'm switching hands and I'm repeating the same maneuver, this time with the micrograsper through the paracentesis and the micro scissors through the main incision to get rid completely of that cyclitic membrane and therefore make my capsulorhexis easier. I still have that air of corneal opacity, but as I've said, switching off the main light enhances visualization. Many times it's just enough to for you to be able to see your capsulorhexis or manage to have an idea of how your capsulorhexis is going, so that you can go ahead through the area of opacity. I'm completing there my capsulorhexis. Again, the utilization of vision blue also helps, and then I proceed with usual hydrodissection, phaco and cataract extraction. So there I'm just removing the dense nucleus of the cataract, and then I proceed as per the usual steps with aspiration of soft lens matter, and finalize the case with lens implantation in the capsular bag. Now this case has been completed successfully, and thank you very much for your attention.